Hello. So I'm Megan. I'm with the public health office in town here called City County Health. I am a prevention specialist and a nurse, and I was invited here today to be able to talk to everybody about they're called ready stations that you're going to be seeing out in the community. And that's something that consists of an AED and now having an overdose rescue kit being a part of something when you go into like grocery store, even the thrift store, anywhere. Like I said, they're going to be these little ready stations that not only has the AEDs, but also has an overdose rescue kit along with it, which just consists of Narcan. So luckily at this time, we were provided the little purple boxes. These are called one boxes. And so that's what you're going to see sitting on top of your AEDs when you go in to a different facility. And so this is what's going to make up your overdose rescue kit. So when we're thinking overdoses, that's when if somebody takes a pill, which consists of an opioid, if you put too much of an opioid in your body, that can cause your brain to not want you to breathe as quickly or as often. And so that's what's happened when you go into an overdose. Your brain tells you to not breathe as much, which isn't good. And if you don't get oxygen into your brain, you can't live or continue moving, doing what you're supposed to be doing. So something that can reverse the side effects of that opioid in your body is something called Narcan. And so Narcan is what you would take to be able to reverse the side effects of an opioid. And then that is what's going to tell your brain to start breathing again. And that's how you are able to recover from whatever pill you might have taken. A lot of people might think that opioids and overdoses only happen when people who are taking drugs illegally or doing them not in a non-prescribed way, and that's not true. Kids can get into something that they're not supposed to, a medication, or if you're someone who was prescribed an opioid and you accidentally forgot if you took a dose yet for the day or not, then you take two instead of one, and that alone could throw you into an overdose because your body can't handle the amount of opioids that you put in it. So that's just something that I like to keep in mind. And yes, it is also talking about people who do drugs illegally. You might be thinking that you're taking something that you bought off the street, but it might not be what you actually bought. And if you take the same amount that you normally always take, but if it's a lot more potent than you're expecting, that's what's going to cause you to go into an overdose. So, like I said, the kits come with Narcan, and Narcan is what reverses the side effects of opioids. And on the box of Narcan, it's really nice. It tells you exactly what to do, what to check for if someone's in an overdose. You're going to look at them, and they're going to be, slumped over. They're going to be very pale, blue lips, and they could even be gasping for air, but it's really slow, and you can tell that they're definitely having a hard time breathing. And so that's when, you're always going to want to call 911 first. This isn't just because you have Narcan on you, doesn't mean that you don't call 911. You still call 911, and you try and shake the person awake, make sure that for some reason, if they were sleeping, then they would wake up. But if they're not sleeping, you're trying to shake them awake, they're not waking up. 911's already on the way. You have your Narcan with you. You would then go ahead and be able to take the Narcan out of the box. There's two doses per box, and you're going to be able to put that in your nose like Flonase, and you'll just push the stopper up, and it goes right into the places that it needs to go to make you start wanting to breathe again. And you don't have to prime it or anything. And like I said, one plunge is one dose. So you wait 2 to 3 minutes, and if you feel like the person hasn't started breathing more efficiently again, then you can go ahead and use the other dose that comes in the box. And by that time, you should be, an ambulance, EMS should be with you, so they would be able to take over. You'd be able to tell them, I've already given one dose of Narcan, but if you were, then they would be able to take over and continue from there. Like I said, this is what they look like when they come in the box. Like I said, just because you have Narcan doesn't mean you shouldn't still call 911. 911 right away is always the best option. And to be honest, if you tell them what you're seeing, they're going to also be able to help you walk through what to do if it is in the case of an overdose. So if you completely forget what to do, just always remember, call 911 and they're going to help you through it. Yes, and you know what? So like I said, in the beginning with these cute little purple boxes that we get, so these are in most places that you go around Barnes County now. If you open it up, like I said, it's going to have the Narcan with you. It's going to have a simple face mask, a pair of gloves, and a wipe in case if it's not your best friend who passed out or your child and you don't want to have mouth-to-mouth contact, but you still want to help them breathe. That simple face mask can do that for you. And it's also going to come with this little tab that you can pull down, and a cute little Southern lady is going to pop up and tell you exactly also what to do in the case of an overdose. She'll also tell you to call 911 too. So, you know, you're going to have multiple people telling you exactly what to do in a stressful situation. So it's going to feel like a breeze. Hopefully you never have to do it, but it'll feel like a breeze. So we'll watch the cute little Southern lady. Hopefully it picks up.
First off, let's take a deep breath. Step number 1 is to check to see if somebody really is unresponsive. You can do that by gently shaking them and shouting, or you can use your knuckles against the sternum to see if you get a reaction. If you find this person is unresponsive, please call 911 immediately. The next step would be to remove the safety barrier devices for you, the rescuer. Once you're protected, remove a single dose naloxone from the one box. You will insert this into the nostril. As you aim the tip towards the ear, you will push the plunger firmly. If you find that this person is not breathing proficiently, you want to use the rescue breathing mask face shield that is in the one kit. Push the bite block down into the mouth of the victim, raise up the chin, pinch the nose, and breathe. Once spontaneous breathing returns, we want to place this patient in what we call the recovery position until the paramedics arrive. And that would be on their left side with at least one hand over their head and a bent knee to keep them in place. Once the paramedics arrive, you want to give them information on everything that you have done for this patient, and you will give them any used or unused naloxone.
Perfect. Yeah, so honestly, knowing how to use Narcan is honestly just like knowing how to use an AED. Both things you just, well, if you have a one box with you, you just turn them on, open it up, and it's going to tell you exactly what to do. Always, and first and foremost, you just call 911. They're also going to tell you exactly what to do. Yeah. So I feel really happy that I was able to express and share this message with everybody. And with the Narcan, you can get this on the shelf over the counter in any pharmacy. I believe online, probably Amazon even too. It is about $50 a box, but if you go to a local public health unit, we give it away for free. So there's no questions asked. There's nothing that you have to answer. It's simply if you just walk in and say you'd like a box of Narcan to have for your house, for your car, for your workplace. That's something that you can get for free without any questions asked. And you know, the more the merrier. The more prepared we are as a community, the better that we can just handle different things that are happening. So just a quick little recap. So opioids are the pills that you take for pain management, which is great. Never want to take pain management away. But if you take too many of an opioid, that's when your brain decides to stop wanting to breathe. And that's when you go into what we call an overdose. And that's when you need someone to administer Narcan to help get that medication into your body to make you want to breathe again. And you always call 911 first because they're your friends, they're your best friends, and they will help you. And there is something called, I think it's a good citizen law. If you were doing drugs illegally or your friend was and they went into an overdose and you needed help, if you called to save them, there would be no actions taken against you for having illegal drugs with you. They would just be happy that you helped to want to save that person or to save yourself. So, yes, questions.
What are some examples of where you can find Narcan in Valley City?
Yes, that's such a great question. All of our first responders, our fire departments around the county, they all have Narcan. Daisy's Bar and their campground has Narcan. Or is it Sibley? They all have it. Every community has Narcan in it at their fire departments or their first responder sites. And then especially in Valley City, all the banks, the grocery store, the thrift stores, the handy hardware, the gas stations. And if there is a place that doesn't have it and you would like to have it, you can definitely reach out, and I would love to be able to partner with you to be able to bring that to your facility. Yeah. Like I said, I'm Megan with the Public Health Unit in Valley City, And this was our Narcan presentation.